Welcome to the Meet the Partner, Saving Lives in Partnership with Law Enforcement. My name is Jeff Bornstein, and I will be running this Dialogue for Health web forum with my colleague Merlene Tucker. We also want to thank our partner for today's event, the National Overdose Prevention Network. Next slide, please. Except for those who are scheduled to speak, all other microphones have been muted to reduce background noise. You can listen to the audio for this web forum through your computer speakers or connected headphones. We encourage you to share your thoughts and questions about today's presentation by typing them in the Q&A box, and we'll answer as many of them as we can. Just click on the Q&A button located on the Zoom control bar at the bottom of your screen. The Q&A panel will appear. Just select all panelists in the drop-down menu, type your question, and click so that your question gets to the right place. Next slide. Real-time captioning is provided today by ACS Captions. The closed caption button is located on the bottom control bar. Just click the up arrow to select options for viewing captioning. Show title will open the window at the bottom of the video screen to display the captions. View full transcript will open a side panel to display the captions as well. Subtitle settings allows you to adjust the font size of the captions. Next slide. Now it is time for me to introduce the moderator of today's event, Dr. Carmen Rita Nevarez. Dr. Nevarez is a director of the California Opioid Prevention Network and the National Overdose Prevention Network. She's a Public Health Institute's Senior Vice President of External Relations and Preventative Medicine, and the Director of Center for Health Leadership and Practice, and the Director of Dialogue for Health. So welcome, Carmen.
Thank you so much, Jeff. Next slide, please. I want to really thank everybody for logging in with us today, and in particular, really thank our panelist, Judy Gerhardt, and hopefully we'll get some really good conversation going. And just so that everybody is aware, you do have the ability to ask questions using the Q&A box that's at the bottom of your screen. Please do so. We'd love to be able to address some of those questions, and I'll incorporate them as the dialogue goes on. So what our objectives are for today is to just give you a little bit of an overview of the National Overdose Prevention Network, to talk about the role of all of the partners in overdose prevention, and to explore how we go even deeper and further in effective partnerships with healthcare leaders and organizations and other people who are engaged in this kind of work. Let's get the next slide. Important to start with a poll. We'd like to know who you are. Could you please just answer the questions in front of you? Do you already partner with or represent law enforcement? So just go up to your screen and click the box that applies, and in a minute we will see the poll results and get a sense of who our audience is. It's very helpful to us to know how to address your concerns and your questions. So we'll keep that open for about 30 more seconds and then close the poll. All right, you want to give us poll results? Very good. We're seeing lots of partnerships with members of law enforcement, and that's really important. And for those of you who aren't, hopefully by the end of this session, you'll see some opportunities or maybe think of some new ways in which to draw attention to your work on the part of law enforcement and get them engaged with your work in saving lives. We've got 5% of law enforcement folks with us, so welcome to all of you. We appreciate your being with us. So we'll go ahead and close out the poll, And let's see yes, thank you for that slide. So let me talk a little bit about what NOPN is and what we can do to support your work. Since 2018, our team at Public Health Institute's Center for Health Leadership and Practice has been working with opioid safety coalitions all across California. We've actually been working with coalitions that cover most of California, serving 33 million Californians and covering nearly all of the state. Our success in this work was also built on the work that we've done in leadership, working with people who work on the ground to solve complex health problems. And certainly if overdose, substance use and overdose deaths is not a complex health problem, then I don't know what is. So taking all of that learning and knowledge together, we help to produce something that we think will help to build stronger partnerships, leverage assets already in your community, help you to learn to work across sectors by getting everybody to the table and adopting, really spreading the adoption of things that work so that you don't always have to feel like you're reinventing the wheel. So those are the kinds of ingredients that we think are important. We're trying to take these ingredients and package them in a way that's useful and quick update for you, and build a national network to save people's lives. Next slide, please. So stopping overdose deaths really does require all of the sectors represented in this wheel that you see before you, and so many more. We wanted this to be readable, so we didn't include everybody. But the point is, you develop a local response when you've got everybody engaged and when we understand what the needs are, and you don't understand that until you have everyone involved. Systems only occur when you can generate dialogue between your sectors, and action stays sustained when everyone is a part of the solution seeking. Next. So we know that that as people work across the country, that there are really some steps you need to go through in order to implement your best practices in overdose prevention, work smarter and more effectively in a coalition, communicate effectively so that people understand what your impact is and where you're trying to go, inform your decisions with real data, with real information that helps you to know that you're staying on track or how you need to adjust, and that you need to plan for sustainable programs and services. This is the model that we bring through the National Overdose Prevention Network, and we hope that by participating with us that you will get a chance to formalize those into the work that you're doing on the ground. Next slide. We focus on the key evidence-based strategies, preventing new addictions, managing pain safely, treating addiction once it happens, and stopping overdose deaths. This is the framework for much of what we do. Next slide. So what we can do to benefit you is bring these practices, partners, strategies, policy, and sustainability strategies to you in a way that is usable by your coalitions, by the people that you're working with. We're excited helping to bring these efforts together. We ask you to stay tuned, sign up for our digest, and see what can help you to build your work. So let me go without any further ado and introduce our speaker. Next slide, please. Judy Gerhardt is a proud 40-year veteran of the Los Angeles County Sheriff Department and retired at the rank of commander, assigned to the Special Operations Division. Her duties included oversight of Emergency Operations Bureau and Special Enforcement Bureau that includes SWAT, K-9, Hazmat, Transit Services Bureau, the Aero Bureau, the Criminal Intelligence Bureau, and the Joint Regional Intelligence Center, as well as budget and personnel responsibilities for Special Operations Division. Commander Gerhardt has decades of experience and covered assignments in custody, patrol, risk management, human resources, and other specialized units. So please, let's welcome her to the podium here. And I'd like to start by asking you to tell us a little bit about yourself and the role that you have played on that intersection between law enforcement and substance use addiction.
Thank you so much for having me, Dr. Navarez. I really appreciate it. I'm so excited to be here. I want to be able to share some of the things that we have done in LA County in hopes that it will generate more action from others. So I got into the opioid prevention and efforts through some family tragedies, frankly. I grew up in law enforcement. My older brothers and sisters were in law enforcement. This is what I've known all my life. My other brother is a doctor. And, you know, I was moving along in my career, and we had the traditional law enforcement efforts of enforcing the laws regarding narcotics. So, you know, the arresting of possession or sales or distributing, manufacturing, that was kind of where my efforts were. And it wasn't until, well, actually, let me back up for a minute. About 30 years ago, when I was a very young deputy sheriff, I used to teach the drug prevention program. We had a program similar to DARE, but we called it something different. And I taught that program for several years. And I didn't realize at the time the impact that it would have on me personally. But through my 4 decades of law enforcement, I look back at that opportunity to connect with those kids and really share a message about good decision making and skill sets. And it just assured me that this one deputy sheriff in this town of 4 million people, could really make a difference to other people. So I took that kind of philosophy throughout my career. Tragically, I lost 2 nephews to opioid overdose, one in 2016, one in 2017, one in Boston, one here in California. And it devastated the family, of course. Simultaneously to that, one of my friends, we were deputy sheriffs together, and we've been friends for 30-something years. Her son found himself addicted to heroin, and when she was crying in the middle of the night, didn't know where he was, it was me that she called, and we were out there at 2 a.m. looking for him, trying to find him, hoping he was okay. I've watched that journey, walked with her in that path, and it was just heart-wrenching. My youngest daughter and one of her friends tragically died of an opioid overdose. And I remember getting that phone call from her at 11:30 at night, and she was just devastated on the other end of the phone. And I thought, you know, we can't just sit back and let this happen. We have to do something. I have to do something. And so about that time, my brother called me, and he was relentless in the most positive way of what is the LA County Sheriff's Department doing about this problem. And I'll be perfectly honest with you. At the time, I was in charge of buses and trains, and I didn't have anything to do with narcotics or any of those things. I wasn't even working on the line in the community. I was buses and trains, and that was my focus. But he would not give up. And through those many, many, many phone calls and emails of information, and just read this, and he raised my awareness. And it was my own ignorance that was preventing me. And I realized that something has to be done. And at the time, this was several years ago, Southern California really wasn't experiencing the devastation that the rest of the country was seeing, particularly in New England. But we could see that it was coming west. And I thought, you know, we have not just an opportunity, but a responsibility to get ahead of this before it gets here. Where I think some of the other states, particularly Ohio, Virginia, West Virginia, they didn't have that opportunity to get in front of the program, to get in front of the problem, and had to deal with it when it was in their lap. But in Southern California, I thought if we could just get ahead of it, maybe we can be in a better place to handle it. So that's kind of how I got into the whole addiction epidemic and what we are going to do about it.
So, so that's a very complex story, and I think probably most of the people that are in our audience today have a story that multiple things that have happened in their lives have brought them to this struggle with personal drive that you have. I'm wondering, did something happen, or did you sort of reach a point where you needed to make the personal sort of known to people in your professional sphere so that they could understand why you were so driven? Is there some event that you can tell us about that helped your colleagues to better understand why this was so important?
I don't know if it was a specific event for them as much as it was for me. I realized one of the issues that was preventing us from dealing with this epidemic was the stigma that was associated to it, because we always thought it was someone else's problem. And even me, when I grew up in my years in law enforcement, I always pictured somebody who was addicted to heroin as a guy in the alley, needle stuck in his arm. That was my point of reference. I had no idea until my brother shared all of this information with me and really started learning about what addiction is and what it isn't and who is affected by it. Because what I learned very early on was we hide behind the stigma because of the stigma of addiction. But the reality is addiction affects everybody, from infants who are born addicted to grandparents who are watching children of their, maybe their grandchildren because their own children can't take care of them. Or we've seen recently even professional athletes and high school athletes who get injured and get prescribed opioids and then get addicted. It was everywhere. It was so prevalent. And it wasn't just that guy in the alley anymore. It was my friend's son or my neighbors or my boss, or it was everywhere and it was affecting everybody. But we were all hiding because we were afraid to talk about it. We didn't want to be judged because we assumed mistakenly that it was a character flaw, that addiction was something about people making bad choices. And so I really learned so much about what it is and what it isn't. And that gave me the strength to come out and say, I'm not going to allow the stigma to silence me. And, my nephews died tragically. And if I can help somebody else to avoid that, that's what I wanted to do. And so I think once we recognize the vast reach that addiction has in our communities, and it's not just, it crosses all socioeconomic barriers and it's everywhere. And we have a responsibility to do something about it. And we can't be silenced because of the stigma associated with it.
So what happens when you speak with your colleagues in law enforcement, and how do you get them to get the same kind of energy, of drive around this interest from the same perspective? How do you engender that sort of conversation?
Well, Dr. Gerhardt, it hasn't been easy. I think that law enforcement often operates in a silo, and we only see what we see. And we're sometimes not willing to recognize that there may be other perspectives. But I openly talked about what was happening, and it wasn't long after that I started getting lots of phone calls, lots of emails, or conversations from people that say, my son, my daughter, my neighbor, my friend, my whoever suffers from addiction. Can you help me? I said, yes, I want to help you. And it was creating a safe place for people to talk about it and for people to realize that, this is bigger than just a decision or a choice. It affects everybody. And frankly, I said, it was my nephew, two of my nephews, but it could have been your nephew. It could have been your child. And we have a responsibility to each other and to our communities to be aware and to educate ourselves about what addiction is. And so it wasn't always easy, and it wasn't always well received. But I think the more I spoke about it, the less fear that there was involved in it, the more education we could provide. I think the medical community has done an incredible job of providing really important information that makes it easy to understand. And the advances that have been made in the medical community surrounding addiction tell us that, this is not somebody's character flaw. And so I think once we start talking about what addiction really is, they're more receptive. And I think I remind them of what our role is. We are community helpers. We are lifesavers. And just because somebody suffers from addiction doesn't make their life any less valuable than the person that's in the car accident or in the building burning that we're quickly to run in and try and save. So we are lifesavers. That is our job. That is our responsibility. That's what we signed up for.
Those are some really important thoughts that you've shared. I wonder if you could talk a little bit about how you've been able to get your law enforcement colleagues to understand that there's the potential for partnerships within the community that they serve, that perhaps the churches or the parents groups or some other, the neighborhoods that they walk, that they're responsible for. How does that sense of partnership come about in the area of preventing overdose deaths? What's the conversation like on your side? What can those of us who are trying to reach into law enforcement communities, what can we say that helps to make that bridge and make a really strong partnership happen and support the next set of steps we need to take?
Well, I think that there is comfort in knowing that we're not in this alone. Many of society's ills are placed upon the backs of law enforcement and expected to us to resolve them. And that's quite frankly impossible. We can't do that, but we want to be a part of the solution. And, I hear from a lot of law enforcement agencies early on that this is a public health problem. It's not a law enforcement problem. And the reality is, it is our problem. It is our problem in our communities, and we all need to be working towards a common goal. So what I think we've learned is that we can work with other community members, including the educational institutions or the health institutions, faith-based institutions, and each bring something to the table because we are stronger together. We are better together. And I think one of the opportunities that law enforcement has that some of those other institutions may not have, particularly the medical community, and you mentioned it earlier, and that is this boots on the ground. We are on the ground. We are interacting with the community every day. That's an advantage we have. So even if we can just be the conduit of information from the medical profession to the community, that's helpful. That's purposeful. And the other thing is, addiction affects families in a lot of different ways. And those effects create an environment for law enforcement to be involved. So it may be the drug addict who is stealing, burglaries, robberies. That may be law enforcement's role in it. It may be families who are devastated and calling because they don't know what to do with their child who is and may be addicted. So there are so many avenues of the tentacles that touch law enforcement. So everybody has to find their mission. That's not to say that law enforcement's primary role of enforcing the law is any less important. I think law enforcement has a responsibility to actively and aggressively pursue those people that manufacture, sell, and distribute illicit drugs because they're taking advantage of the most vulnerable population. So absolutely, law enforcement's role in that aspect is clear. But when it comes to prevention and intervention and rehabilitation, criminal justice system has a lot of other opportunities to interact with these other entities to really move the ball forward.
So there's a couple of really good questions from our listening audience, and I want to start with the one that I think probably is the best place to start. How do you get past the fear of law enforcement with some members of the community? I mean, how do you bridge that gap? What does that take?
Well, that's not an easy question. I know that there is a fear, and I think now community norms are changing a little bit, and I think that we are recognizing that addiction is a medical issue. And so if law enforcement community can work with the health community and the treatment centers to say, this person is struggling, let me get you help, not through the criminal justice prosecutorial avenue, but through the medical avenue. Let's see if we can get some treatment and some rehab. So I really think it's about developing those relationships where people understand that law enforcement is not just interested in putting people in jail and incarceration, but really let's solve the problem rather than just put a Band-Aid on it. We can take somebody to jail, put them in jail for a week. That's not going to solve the problem. It doesn't help anybody. So law enforcement work with treatment centers, the medical community, to take that same person who's suffering from substance use disorder, get them into treatment, get them on some medication. I'm a huge proponent of medical assisted treatment. I think it's an answer. Let's get them through that path so that they no longer have to be addicted. So they no longer have to search for that next high.
Right. What is it? How would we? Boy, the questions are just really piling in now, and they're really good. So let me start with one that I think is probably just a real basic question. How do you get law enforcement officers to carry Narcan? What does that take?
Well, we had a pretty good success in the LA County Sheriff's Department. Getting Narcan to a law enforcement agency is often a challenge. Sometimes it's budgetary because, you know, the budgets of law enforcement agencies are pretty restrictive. And when it comes down to, are you going to buy bulletproof vest or are you going to buy Narcan? You have to make those very difficult decisions. So what we did in the Sheriff's Department, we pursued grant opportunities. We were actually assisted through Department of Public Health for some grant opportunities for Narcan. And then we were assisted through the federal government through some grant opportunities. And so I think it's about finding ways over those hurdles. But once law enforcement officers understand really how easy it is to deploy Narcan, the way I presented it was, it's your choice. We'll give you the tools. It's your choice whether to use it or not. That's your judgment. And that allows them to say, yeah, I'm not going to do this or I'm not going to do that. But when the time comes, law enforcement is in the life-saving business. So when the time comes and they see somebody overdosed and they have the solution in their hand, they're going to use it. I said, you know, you see that guy in the alley, you think, I'm not going to save him. It's your choice. You see the 16-year-old girl in the bathroom, it's also your choice. So we give them the tools and they make the choice. But remember, law enforcement officers put their lives on the line every day to help people, and they are lifesavers. This is what they do. And so the other thing that we did, and I think it became really important, is we celebrated the life-saving efforts. We celebrated the success when they were able to deploy Narcan and brought people back to life. We celebrated those events because it allowed other people to say, yeah, it's okay to do this. And the gratitude from the community or from the family members of the people that we saved was incredible. So it's really about celebrating the successes, taking away the fear of what deploying Narcan is. It's so simple. It's really pretty risk adverse. It's easy and it can change somebody's life. And I think that's what we want to do.
So several people are asking about harm reduction. Talk a little bit about harm reduction and how it gets integrated into training so that law enforcement can understand what it is and what it isn't, and how they can use it as a tool in helping to save lives.
Well, I guess harm reduction, it's a new topic. It's not something that kind of is institutionalized in law enforcement. Law enforcement is pretty antiquated in the way we do things, and we are pretty reactive. And that's kind of the nature of the business of what we do. And so harm reduction is kind of more on the proactive side. What are we going to do to help people not go down that path? I know that there's a lot of discussion about like safe injection sites and those kinds of things. I think there's a lot more discussion to be had. I struggle with the idea personally. I know that there are a lot of people that are fans of it. I still struggle with this. You know, are we going to create a safe place for somebody to do harm? I don't know. So I think harm reduction is really about education and awareness and understanding and allowing somebody who suffers from this brain disorder, from substance abuse disorder, given the path to get help.
Yeah. Well, we have a really long way to go, I think, on all of our sectors to bring all of the best tools into action. I mean, I think you said it really well when you mentioned that, you know, you've got the tools in your pocket and you're making a decision to use them or not use them. And hopefully people make the decisions to use all the best tools every chance they get. So we've come up at the end of our hour, and now the questions are really good, and I'm really sorry we can't get to all of them. But let me just ask to go to the very last slide and ask folks to just become aware of the fact that we do run these Meet the Partner sessions fairly regularly. We run a number of other web-based services that will help you to do the work that you need to do. Please let us know the ways that we can support you. You can contact us on the email address that is at the on the slide right in front of you. And I really hope that we as a nation get much better at understanding the problem of overdose and work diligently together in partnership to save lives. So thank you to everybody, and there will be a recording shared. It will be back on the website that you registered. Please check in a few days and you'll get a chance to reconnect with us. So goodbye to everybody, and thank you all for participating.